Assalamualaikum and a very good morning to everyone. My name is Roberto, and for today I will be sharing about the pros and cons of genetic testing. For introduction, genetic testing, when appropriate, is a powerful tool to gauge a patient's risk for disease. On the surface, the concept may seem like a no-brainer, as a sample of blood or saliva can offer clues to your body's genetic defects, as a roadmap to predicting future problems ranging from Alzheimer's disease to cancer. But put into practice, genetic testing is more nuanced. The results, after all, might not be what the patients want to hear, especially because they could reveal an inherited mutation that puts themselves or their kids at risk. The results may trigger emotions disturbance, and it can be costly too. In short, genetic testing has both advantages and disadvantages. By definition, genetic testing is a type of medical test that identifies changes in chromosomes, genes, or proteins. Moving on to our first key point of the presentation, which is advantages of the genetic testing. Genetic testing has helped in revolutionizing the cancer treatment. For example, the breast cancer. It helps in better understanding of molecular genetic of cancer cells. By genetic testing, we are able to identify that breast cancer occurs to the overexpression of HER2 receptors. A monoclonal antibody trastuzumab that binds to the excess HER2 receptors can prevent the HER2 receptor from signaling the cells in the breast to reproduce uncontrollably, therefore preventing the tumor from becoming more aggressive. It also gives impact on the disease prognosis. In acute myeloid leukemia that is characterized by accumulation of myeloid precursor, which is blast cells, in the bone marrow for more than 20% or less than 20%, genetic testing helps in determining whether the patient has favorable or undesirable prognosis. Genetic testing is also useful in detecting birth defect in utero, as it is used as a prenatal genetic testing. This test is recommended for parents that carry recessive genes and for mothers that have risk from chromosomal abnormalities. Early identification of genetic disorder will allow the parents to be better prepared for a special need of the child, or they may choose to terminate the pregnancy. It is also helpful in personalizing the medical treatment based on the pharmacogenomic aspect. Drugs such as abacavir is highly effective treatment option for most HIV patients. However, it causes severe side effects in 5 to 12% of the patients. Patients with HLA-B5701 gene variant were found to be the most likely to get these side effects. By screening for this gene variant, another treatment option could be offered to the patient for better outcome of the disease. This proves that genetic testing does bring benefits to the medical field. However, for every pros, there's also cons that weighing against it. And that brings us to the next key point of our presentation, which is the disadvantages of genetic testing. As I mentioned earlier, prenatal testing may be able to detect the birth defect in utero. However, it requires a sample of amniotic fluid or tissue from the fetus, and for that, it also carries risk of miscarriage. Genetic testing also involves emotional, social, or financial consequences from the test result, as people may feel angry, depressed, anxious, or guilty once the result has been received. And this may create tension between the family members because it reveals information about other members in addition to the person who is tested. Socially, there are possibility of genetic discrimination in employment or insurance, and financially, due to the test is a highly cost procedure itself, it may bring stress to the patient as everyone has their own financial limit. Another disadvantage of genetic testing is its lack of treatment strategy for many genetic disorders once they are diagnosed. Genetic testing can also raise ethical and regulatory concerns regarding access and use of this service, as it is not accessible for everyone due to its high expense. there are only small number of known disease-causing and disease-modulating mutation. These tests also need highly resource-intensive curation and analysis of raw data with associated costs. And it may be expensive if not be covered by insurance, although financial aid and low-cost option may be available. Overall, genetic testing is not an indication of full body review, as the testing itself is targeted to a certain group of people. For example, patient whose parent was tested for genetic heart condition wouldn't be candidate for BRCA1 or BRCA2 testing to determine the breast cancer risk, as they are not involved with breast cancer. When should the genetic testing be done? Well, genetic testing can be used as the confirmatory test for diagnosis, as pre-symptomatic test, and also carrier test. For the confirmatory test, when a patient is present with symptom of a disease caused by mutated genes, it helps to confirm the diagnosis. As for the pre-symptomatic test, when the patient has positive family history of genetic condition, it helps to predict the risk of having the disease. And for the carrier test, when the patient has positive family history of genetic condition, it helps to detect the presence of genes associated with the genetic disorder and any gene mutation. On the pharmacogenetic side, when a patient has a particular disease, genetic testing helps to determine the most effective and beneficial medication and dosage that is suitable for the patient. It is also can be used as a prenatal testing test that helps to detect any abnormalities in her baby while the mother is still pregnant. And screening in newborn to helps to test any genetic or metabolic abnormalities in newborns. It is also can be implied as a pre-implantation test. When the parents want to conceive a child through IVF, genetic testing helps to screen the embryo for any abnormalities. Well, that's all from me. The presentation shall be continued by my friend Lukman, and thank you.
Assalamualaikum warahmatullahi wabarakatuh, and a very good morning. My name is Luqman Hafi, and I would like to continue our presentation regarding genetic testing. So there are many implications for genetic testing, but right now first I have to discuss in terms of medical applications. So in terms of medical application, firstly, genetic testing, it helps in diagnostic testing. It is useful to diagnose diseases involving single genes. For instance, cystic fibrosis, sickle cell disease, and muscular dystrophy. It helps to rule out genetic conditions as the cause of symptoms. Next is it helps in predictive testing. It is useful because it helps to predict a disease that has not yet caused symptoms, and it assesses the risk of developing a disease. For instance, in BRCA1 and BRCA2 mutations. Thirdly, in genetic carrier testing, it helps to determine the presence of a gene that could lead to a disorder. It is done in couples with a history of autosomal recessive disease. Next, it useful in prenatal or newborn screening. It helps to detect aneuploidies. It is non-invasive cell-free fetal DNA screening because it uses DNA released from the placenta into the maternal bloodstream. Besides that, it helps to predict response to medications because it determines the therapeutic dose of some drugs, and it is useful to look for variants in genes that encode for drugs metabolizing enzyme. Next, genetic testing are useful in cancer treatment because it helps to identify somatic mutations and to determine the prognosis. Last but not least, it is useful for tissue typing for transplantation because genetic testing helps to identify major histocompatibility complex MHC genes to prevent graft rejection. So next, in terms of social and ethical approaches, For in terms of social approach, the storage of genetic screening data and registries of patients creates particular concern, given that the results may impact negatively on family members. Besides that, identification of a genetic condition before birth raises issue on whether the parents wish to terminate the pregnancy. In terms of ethical approach, genetic testing might causes invasion towards a patient's privacy. Like other medical information, results from genetic testing are considered confidential. However, once the person undergoes genetic testing, others may know the detail of their genome. Besides that, the right of the individual to control his or her destiny with or without reliance on genetic information, and to avoid interference by others with important life decisions, whether these are based on genetic information or other factors. So now we're going to discuss, does insurance pay for genetic testing? Insurance for genetic testing will be covered if it got recommendations from doctors. It also depends on the type of insurance policy the insurer pays for. Examples of the insurance company are MetLife and Alliance Genetic Testing. So all in all, as a conclusion, it is crucial to know the various pros and cons of genetic testing, as it could help people from several types of problems. It is also important for the healthcare professionals especially to know about genetic testing, which covers on when it should be done and to whom, as the benefit should be utilized completely whenever possible. It is also essential to realize the implications to prevent any undesirable effects. Plus, issues related to insurance and genetic testing should not also be taken lightly. Therefore, knowledge about genetic testing is indeed crucial. So here are the references that we use for our presentations. And here are the lists of group members that helped in preparing this presentation. That's all from me. Thank you.